You're very welcome back to Ireland AM. A debate has emerged in the cosmetic industry whether nurses need to be directly supervised by a doctor when Botox injections or fillers are being administered.
We're joined by President of the Irish College of Aesthetic Medicine, Dr. Sean Fitzpatrick, and the Chairperson of the Dermatology Aesthetic Nurses Association of Ireland, Christina O'Rourke, to discuss. Good morning. You're both very welcome to the show.
Thank you for having me.
Sean, we might start with yourself, and you may bring us up to date on what the laws currently are on who can administer Botox in this country.
So the laws are unchanged since 2007. If you open up a box of botulinum toxin, aka Botox as it's known on the street, in it is a pamphlet and they all say the same thing. This product must only be prescribed and administered by a registered doctor or dentist or prescriber. And prescriber is the key word. And there is an allowance within the law in that 2007 amendment where we can allow a nurse to administer the botulinum toxin. So
there's no legal impediment as such in stopping them from doing so at the moment?
Stopping them from administering Botox?
Yeah.
No, absolutely not.
So your issue is you don't believe they should? You believe it's only doctors and dentists should?
I wouldn't say it's an issue. It comes down to the interpretation of the text within the statute, which is under the direction of a doctor or dentist. Now, I've spoken to the insurers, aesthetic insurer and their underwriters. To provide botulinum toxin treatments in Ireland, you have to have a policy in place if something goes wrong. And they will only give a policy to a nurse who administers toxin once a doctor has first met the patient and performed a full, thorough, face-to-face consultation, and thereafter can delegate the administration to a nurse.
Is that because the guidelines are kind of cloudy, though?
It is a grey area, and if you speak to HPRA, if you speak to the insurers themselves, they will say the same thing. It's a grey area, and we are still trying to seek clarity on this.
Christina, talk to us about nurses administering prescription medication, because they do that in a lot of settings.
Yes, so in line with NMBI regulations and local policies and procedures within a health service provider, a nurse can safely administer a medication, any medication that's prescribed by a doctor. Botox really should not be singled out as a drug. That's NMBI, our regulator, has never singled out any provision for one drug. We go by our guidelines and our professional code of conduct and ethics in order to provide safe patient care, and that would be the administration. There is no specific guidance for Botox. The SPC that's been mentioned, the leaflet that comes with the Botox vial, it says should be administered by a physician. However, this SPC commonly in practice across all areas of nursing, you would see nurses administering medication with this leaflet as a guideline, and NMBI would support that. It is used as a guidance document. It is not always to the letter of the SPC. If a local policy within a health service provider or a clinic allows for working outside that SPC, and it's very strict and robust policy, that is considered safe practice, and it is commonplace within all areas of nursing at the moment.
Just supposed to dumb it down for someone like me who's not very good at reading these medical leaflets. I mean, if you're in the community now, I know, my mother was at home with hospice care. She was given morphine, which I would be terrified of myself, but there were nurses doing that, and perhaps, I don't know what you think, but that they're very serious medications you're administering there. So is that the issue you're talking about?
Yes.
If they could have ramifications for the community if that does happen?
Yes, and morphine would be considered a much higher risk, record-wise. There would be a safety profile there that would be, yes, a competent nurse who's qualified to administer.
It's with training, isn't it, really, if you're trained properly?
Just an important point to note, may not be an advanced nurse practitioner. There are staff nurses administering morphine and administering medications of that description.
Sean, what do you want to come in there and say?
But the administration of a drug is a very small portion of what's actually going on. In that scenario and in the hospital, in the communities, there are always medical doctors on call, responsible, who have prescribed those medications, who have decided...
on call, they could be miles away. I know in my instance, I mean...
It doesn't matter, they are still responsible for those drugs. And that's the difference. Within the healthcare setting, physios, doctors, nurses, occupational therapists, they all have defined prescribed roles based on their training, their clinical responsibility. Just because somebody is delegated to administer a drug does not equate them
in your
to being a
college,
medic.
like, do you in your college, do you train people in the college, or what way does it work, or do you train other doctors, or?
Or you're talking about
the
college. So we provide ongoing CPD education for our doctors. Yeah, we do.
So you have an actual college?
Well, we are called the College of Aesthetic Medicine, but at the moment we just represent aesthetic medical doctors.
Oh, so it's a representative body rather than a college itself. So
at the moment, yes, but we are working and liaising with, for example, the Royal College of Surgeons to see if we can come in as a faculty of aesthetic medicine, like you would have a faculty of paediatrics or orthopaedics.
From my understanding, the risks here is kind of like risks of infection. I know there's anaphylaxis potential management that would be needed as well, but these are things that nurses are trained in.
Yes, can I just say a nurse should not administer a medication or an injectable treatment without having that mandatory training completed. NMBI would require that, our regulator. So therefore, like that, if there was an emergency situation where a patient showed signs of anaphylaxis, the adrenaline is there, the safety protocol. Say DANI members would follow ACE guidelines, which are international best practice. They are in line with our national programme for anaphylaxis management.
But who's prescribed the adrenaline? Who's responsible for storing the adrenaline?
Yeah,
the medical governance within that clinic would ensure that. It absolutely
Which
ensure
is
that.
having a doctor there if something
not
goes
on
wrong.
site necessarily. Like in other areas, not on site.
You're saying it should
necessarily.
but I'm just wondering about the law here. Like you say it should be, but is that a legal requirement? Is what I'm wondering about here.
So to explain, we have the law, we have the regulations
and the interpretation
from the NMBI for nurses, and we have local policies and procedures. And this is really important within a clinical setting. The local protocol is the detail of what is okay. The nurse, you may be an advanced nurse practitioner, you may be a clinical nurse specialist or a staff nurse. The detail of what is appropriate and what the appropriate level of supervision and direction given depends on the experience of the nurse.
I'd be a lot more concerned that like I just see from people wandering around, there's people administering Botox and fillers or botulinum or whatever you want to call it, out of caravans at the back of things. And like I'd be much happier. Like I put my hand up, I get fillers, and it's a nurse that does it, a registered nurse that does it, and I trust her implicitly. I would be much more terrified and I'm much more wanting to regulate the fact that there are people willy-nilly who do a course on the internet for 5 minutes and the next thing they have a certificate and can do this. Should this not be where you should be directing your
concern.
That would be our concern.
We're
united on that.
The public, members of the public are being directed more towards these. If nurses are to be removed from aesthetic practice, which there has been suggestion in the last number of weeks to restrict aesthetic practice, dermatology aesthetics to just doctors and dentists, for us that would really feed into this, guiding these members of the public, and it's all about patient safety here. We're 15 years campaigning for this. We now have the patient safety licensing bill on the programme for government, and we feel really nurses have fulfilled our patient advocacy role in ensuring that, and we'll continue, and we welcome further regulations that will give specific guidance to nurses working in dermatology aesthetics.
And how about nurse practitioners? Is that something that you would to administer Botox under guidance or direction for a doctor? Is that something you could get on board with?
So the Irish College of Aesthetic Medicine, we will get on board with any proposal from our nursing colleagues where there is clear clinical governance, where there is clear medical oversight, and where patient safety is protected. There is a reason why Lewis Hamilton and Eddie Jordan have to wear a seatbelt. No matter how good you are, something can go wrong.
It can go wrong with a doctor as well, though. What's that? It can go wrong with a doctor.
It's gone wrong for me, but I'm a prescriber. I can act quickly and I can access these medications and be responsible for those medications.
Nurse prescribers around as well. Am I right in thinking that?
Yes, but a nurse who's not a prescriber is not permitted by NMBI to administer an injection without local clear guidance and safety protocols in place, such as anaphylaxis management.
So if there was a nurse prescriber, then really that's the training to the degree that you'd be happy with?
We can get on board, as I said, with anything where there's clear governance. I'm not against that idea. But again, in the case of something going wrong, what is the plan? You know, having protocols is great, but being able to prescribe for those medications that can be life-saving is key.
An emergency stock of adrenaline for anaphylaxis management should be on site. It would be procured through the medical doctor
There's
who is
far more things
associated
that
with
can go wrong
it
with
would be
anaphylaxis.
procured.
Yeah.
Yes, absolutely.
Far more things. There's
Absolutely.
infection. There's visual disturbances.
We could go on about this all day. Unfortunately,
Yeah.
we're after running out of time. But thank you both so much. We're only at the tip of the iceberg with this. But thank you so much for joining
you.
us
Thank you so
on
much.
the show.